These are the steps to using an infusion pump. So first you would verify the healthcare provider's orders and gather all the necessary equipment and supplies that you're going to need. Then you would introduce yourself to your patient and their family and perform hand hygiene. You would close the patient's curtain to ensure that there's patient privacy. You would then identify your patient using 2 patient identifiers. The first one would be their first name, last name, and then their date of birth. If they're nonverbal, you would use the first name, last name on their bracelet and their patient medical record number. You would need to have a calculator or a piece of paper and a pen available in order to calculate the flow rate. Then you would determine the hourly volume of the infusion and then divide the total volume in milliliters by the number of hours it was ordered to infuse over. You would insert the spiked end of the pump tubing into the IV fluid bag and then prime the tubing, squeeze and fill the drip chamber and make sure to eliminate all the air bubbles from the tubing, and then you would open the drip regulator to allow the tubing to fill with the fluid. If the patient did not have any fluids hanging, you would flush the saline lock with 2 or 3 milliliters of normal saline. Then you would insert the IV tubing into the chamber of the control mechanism. Depending on what machine you have, that is based on the manufacturer's instructions. You would close the door to the control chamber and connect the tubing to the patient's IV. You would press the power button to turn on the device and select the required volume in milliliters per hour and then press start. You would open the drip regulator completely while the machine is in use, and then you would label the tubing with the date, the time, your initials, and any other information that your hospital requires. You would label each IV bag, including the type of fluid, any additives, the patient's name, the date, and the start time of the infusion. You would instruct the patient what the alarm means if it ever goes off. You would tell the patient to avoid raising their hand or their arm because it will affect the flow rate, and then you would ask the patient to also avoid touching the control clamp. You would help the patient into a comfortable position and place anything that they need within reach, and that includes placing the call light within reach that they could use to call you if anything goes wrong, if they need anything. You would raise the appropriate number of side rails and lower the bed to the lowest position. You would dispose of any of the supplies that are left over and clean the patient's room. You would remove and dispose of your gloves, perform hand hygiene, and then you would monitor the infusion rate and assess the IV site for any complications, the patency of the system. You would do that every hour and then whenever the alarm sounds. You would then document the IV fluid solution and the hourly volume rate as well as how the IV site appeared.